few viewpoints that I'll share, and at the end, let's be realistic about how this is going to take place. So when I say I'm a robotic surgeon, what do? I've spent 20 years in surgical operation theaters, over 10,000 hours working with various robotic surgical systems. And the robot has really redefined the way that we operate today in the 21st century. So what is a robot? For those of you who are not aware, a robot is basically an advanced way of doing minimal access surgery. You must have heard of laparoscopic surgery. This is the next level laparoscopic surgery, where through small incisions, we are using precision instruments docked onto robotic arms. And you may see that I'm not sitting next to the patient. I am at a surgical console, which is about a few feet away from the patient, and I'm using these master controls, okay, which are close to my hand. I'm using these master controls to do precision control of the instruments that are docked onto the robotic arms. I'm sitting at a console which is three-dimensional and wearing 3D glasses so that I can have very good magnification and 3D vision when I'm operating in difficult to access areas. So this is the external view. Could you just play this video? Yeah. This is the external view when I'm operating on the robotic surgeon. Here I'm doing a robotic partial nephrectomy, wherein I'm removing a part of the kidney, not the whole kidney, with precision. And this is my surgical assistant who is just there to change the instruments. But you can see the movements of the robotic arms. They are the ones that carry the precision instruments. And this is how I end up doing my robotic surgeries with precision. Now to give you an inside view, I gave you an outside view. So let me go to the next slide. Yeah. So this is an inside view. Now I have 10x magnification. Okay, I have immersive field. I feel as though I'm sitting within the body and operating, and I can do precision movements. Yes, now it moves. I can do precision movements. This is me cutting out the prostate, containing the prostate cancer, dividing it from the urethra, and you can see the precision. It was very difficult to do this in the open surgery era or the laparoscopic surgery era. I can do this with perfect precision, and you see the suturing. This is at the depth of the pelvis with 10x magnification, precision movements, and these movements are very difficult to achieve with laparoscopic surgery or with open surgery. And that is why it is safe to say that robotic surgery has revolutionized the way we perform surgery today. So, coming to AI, which is the central theme of this fest or whatever meeting you're having. Okay, so AI is already in my OR. So far I have tried to tell you I am pro technology and I'm pro AI. And I'm already using AI. And how do I use AI? It starts from the time I plan my surgeries. You can see the image on the left. So that's the preoperative planning 3D modeling that is rendered with AI help. And the thing that you see in green is the kidney tumor. It's in a horseshoe kidney, an anatomical variation. So all the blood vessels are different. Okay, so I need to cut out the tumor, save both the kidneys. And if I have this kind of 3D model with me before I operate, it is very clear to me how I can achieve it in a planned manner. Now let's move to the next level, the image on the right. The image on the right is a work in progress, where we are taking the help of AI engineers sitting at the back end, trying to inculcate our preoperative 3D models in real time and helping us in real time. That's an intraoperative picture, and that's an ultrasound probe on the kidney, where I can get the rendering of the previously 3D modeling that has been done. So in real time, I'm able to cut out only the tumor and save the rest of the kidney. And trust me, it makes a hell of a difference when we are able to save the kidney, because we can potentially save a patient from future kidney failure and dialysis. So it is life-changing. Where else do I use AI in my day-to-day surgeries? Okay, you can see by the end of the day when I've operated, I get a link to the cloud with an email, which is with a link to the video of my surgery that has been done. And with all the annotations done by AI, I don't have to sit and figure out which step, what time, how much time I'm taking. AI gives me all that information, and I have not trained the AI. AI has already sat and annotated all the steps of surgery. Okay. Further, if I want to improve, if I want my trainees to improve, so each step of the surgery has been benchmarked against global average, okay, so that we know how much time am I taking more time, am I average, am I better, how can I get better. So on a daily basis we are improving, okay, and this is with the help of AI. Now what my real wish list would be is I need a surgical rehearsal engine with the help of AI. I should be able to have a model where I'm able to operate on a patient the day prior to doing the actual surgery, so that I can anticipate all the possible situations, anatomical variations that I can encounter during the actual surgery. Some things like automated repetitive, I would like to automate repetitive steps. You saw the portion of the video where I was actually stitching up the bladder to the urethra. It's a low stakes step, it's an important step, but there are no vital structures around. If I can automate the robot to do that step, okay, we can probably increase our efficiency even better. I would like real-time navigation, no-fly zones, structures that I should not be touching, okay? So that should be there integrated with AI help. Performance metrics for standardization. So we have so many surgeons, so we need to see who are the best, not for public consumption, just for the hospitals to know as to how their surgeons are performing. If they are underperforming, they need more training, that can be provided. Real-time margin status. So since I'm a uro-oncosurgeon, many times for me it's very important that the tumor is removed in totality and the margins are negative, as in there is no disease left behind. So if I can get real-time margin status with the help of AI, that would be a game changer. And I'm sure these are works in progress. We are going to be there. But surgery is not a predictable system. Okay, we have to adapt in real time. Patients are not the same. The anatomy may vary. We have so many variations of the renal blood vessels that every time we may be surprised, even in spite of preoperative imaging. Patients may be on blood thinners, patients may be obese, patients fibrosis or scar tissue may be hiding vital structures. So imagine a situation wherein AI has to automatically do these surgeries. It takes decades of practice to reach there. And in engineering terms, surgery is not a closed system. It's an open, adaptive, high-stakes system. So we have to adapt in real time before we can actually call ourselves good surgeons. Whether AI is going to reach there, only time will tell. Okay, now take a look at this video. Sometimes we have these scary moments. So thankfully this didn't happen to me. You can see the amount of blood loss there is. This is the main blood vessel of the body called the aorta, okay, which is pumping out blood so fast that it can lead the patient to death in a matter of 2 minutes. I really want to know at that point what AI programming can be done to prevent or salvage such a situation. But what do humans do best? We collaborate. Whenever a situation like this happens in the OR, we call for immediate help. And this is how the OR may look. And this is an AI generated image, but I didn't have that chaotic image with me. But I want to show you that chaotic status in the OR at that point of time, okay, will be really, really wonderful because humans collaborate. How will AI achieve this? So I want to know that. So I'm sure, we can train AI all we want, but this is where collaborative human intelligence scores over artificial intelligence. So precision can be automated. Precision can be outsourced to AI, but you can't outsource responsibility. Who is going to talk to that family when we finish the surgery and tell them, hold them through the recovery process, or sometimes even, pronounce a patient dead? How many times we have gone through this at 3 a.m. So ultimately, human beings own the responsibility of doing all this. So what is the true purpose of technology? Is it to make us move away from complex responsibility, or is it to make us evolve into better professionals and better surgeons? So medicine ultimately is not just an efficiency problem. I know as engineers you may think we need more efficiency. As technology people, we need more efficiency. But medicine is also a humanity problem. We cannot forget that. But this is my last slide. I would like to bring you to this thought that why should we discard human potential And why should we discard human capital? It takes 15 to 20 years to train an excellent surgeon. Okay? So with all the anatomical variations and with all the possible situations, it takes 15 to 20 years for a surgeon to mature. Why should we lose that human capital? Why not augment their capacities rather than automate surgical processes altogether? So AI can shorten learning curves. It can standardize excellence. It can democratize expertise. But it can also make an average surgeon good, a good surgeon better, a better surgeon excellent, an excellent surgeon consistent. But what it cannot do is complex judgment, ethical responsibility, and empathy that we share for our patients. And finally, a robot may hold the instrument, but ultimately a human being has to hold the responsibility for healthcare and surgery. Thank you very much.